Hi, this is Dr. Gary Tanchak with Phototov Chiropractic. I'm here with Katie. She came to me a few weeks ago with some clicking and popping and some pain in her jaw. So I'm currently co-managing her jaw dysfunction with her dentist, and I just wanted to go through a treatment with Katie so you could see what it may look like. I know a lot of people deal with tightness, or maybe they clench or grind their teeth and may not know who to go see to get that treated. So I'm going to run through just kind of what my findings are, what type of manual therapy I do, and show you what a chiropractic adjustment looks like. Often what happens with the jaw or the temporomandibular joint is that we either clench or grind asymmetrically. So we cause tightness on one side of the jaw, which creates hypermobility and pain on the other side. So for example, Katie tends to have a lot more tightness in the muscles that move her jaw on the left, which causes her right side to move more than it should. So she gets a lot of clicking, a lot of pain on the right side. So I'm going to go through each of the muscles that can get tight. Just above the ear you have the temporalis muscle, which attaches to the jaw right here. Then you have right here is a rectangular muscle called your masseter that goes from the cheekbone down to the jaw. And then on the inside of the mouth you have the pterygoid muscles, which sit just about here, and they protrude the jaw forward and back. So I'm going to start by just palpating the temporalis muscle. I'm looking for tight and tender spots on the muscle. And then what we'll do is we'll just put a little tension on the muscle, and then I'll ask Katie just to open her mouth, which will stretch the muscle a little bit more than you possibly could on your own. And relax. And then at home, you can kind of just self-massage just above your ear like this. And then moving down to the masseter. Again, it's just below the cheekbone. So we want to just put pressure and then a little tension downward. And then I'll ask Katie to open her mouth. And I just follow that down. And close. And then everybody's favorite part, you have the pterygoids, which sit on the inside of the mouth, just if you follow the teeth all the way back. So for the pterygoid, I'm just gonna ask Katie to open her mouth halfway. And I'm just gonna slide my finger up along the top teeth into the back corner, and we're going to use pretty good pressure. Often what we find along with TMJ dysfunction is upper cervical dysfunction, so the joints of the upper spine tend to get restricted in their motion, which can affect the way the jaw moves as well. So right now I'm going to be just checking Katie's upper cervical spine to see what kind of restriction she has, and then I'll be releasing her neck with a chiropractic adjustment. So what I'm feeling for is each individual joint of the neck to see how well they're moving. And when I find one that's not moving as it should, which it should feel nice and springy, that is going to be an area that I'm going to release with an adjustment. So what I'll do is just bring Katie's head into this position here, and it's just a quick thrust, which releases that restriction of the joint, restores range of motion so that the neck can move as it should. And we're going to do one on the right side as well here. Good. And the cracking sound of a chiropractic adjustment is nothing different than if you were to crack your knuckles. It's a gas bubble forming in the joint. And again, that's going to send a signal to the brain just to relax the muscles in the area and restore the range of motion.